The United States Secretary of Health and Human Services has admitted that not everyone can be tested for coronavirus if they suspect they are infected.
Alex Azar revealed that there's a surplus of testing kits, with 1.1 million already at labs across the country, and a million more on the way, during a coronavirus task force briefing in Washington, D.C. on Tuesday.
Despite 4 million more tests due to be delivered by the end of the week, Alex Azar said Americans will only be able to find out whether they have contracted COVID-19 if a doctor gives the go-ahead.
There's a false premise. Just because I as a person say I'd like to be tested for coronavirus, I can walk into a minute clinic and say, give me my test please. That's not how diagnostic testing works in the United States or frankly anywhere else, Azar said.
His response came when asked to clarify comments made earlier by President Donald Trump, who had said everyone will have the opportunity to undergo testing.
Azar insisted, we've always been clear. If their doctor or public health physician thinks they need to be tested, it needs to always be clinically indicated.
By Tuesday evening there were 959 confirmed infections in the U.S. and 29 people had died.
Earlier in the briefing, the task force encouraged telemedicine. It means doctors will have to make the decision about whether a patient was worthy of being tested, via phone call or video chat.
A year ago Medicaid expanded to allow people to get medical advice without going to doctor or emergency room.
Speakers credited Trump for that step forward in health insurance, adding that it's of benefit to seniors who are particularly vulnerable right now.
Azar reinforced earlier advice that people experiencing symptoms should not go to their doctor's office, but call into a general practitioner, clinic, hospital, and follow infection control procedures given by staff.
They will decide, working with you, whether a test needs to be done, Azar said, claiming it's going to be an even better, closer to the patient experience.
Vice President Mike Pence had previously reassured Americans who had complained it was near impossible to get tested.
Pence stepped in to say that Trump had only directed us to essentially change the criteria CDC was giving labs around the country.
We heard people only mildly symptomatic were told they couldn't be tested. We changed that description so anyone who wants to be tested at a doctor's orders can at a doctor's request be tested now, Pence explained.
Hours earlier, Trump advised Americans to just stay calm and the coronavirus will go away as he attempted to calm the nation amid growing fears about the outbreak.
It will go away. Just stay calm. It will go away, he said during a press conference on Capitol Hill after he met with Republican senators about a package to combat the economic fallout from the disease.
Trump did not attend the Tuesday evening press briefing.
U.S. Surgeon General Jerome Adams, Director of the United States National Economic Council Larry Kudlow, Coast Guard Vice Admiral Daniel Abel, Coronavirus Response Coordinator Debbie Birx, Seema Verma, Administrator of the Centers for Medicare and Medicaid Services, and Robert Redfield, Director of the Centers for Disease Control and Prevention were some experts who spoke on his behalf.
Despite Azar noting the false premise regarding testing, the team praised Trump for getting the kits out so quickly.
They also addressed Trump's earlier meeting regarding payroll tax relief, making sure hourly workers with no paid family leave didn't feel they had to go to work if they contracted the virus.
Trump's efforts to ensure small or medium-sized companies didn't suffer amid the outbreak was also noted. But the speakers could not comment on finer details of the tax break for companies.
Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Diseases, urged the nation to take an all-hands-on-deck approach to the coronavirus and told officials to plan for immediate measures even in states that haven't had cases show up yet.
Like other coronaviruses, including those that cause the common cold and that triggered SARS, COVID-19 is a respiratory illness.
Although having a runny nose doesn't rule out coronavirus, it doesn't thus far appear to be a primary symptom.
Most people only become mildly ill, but the infection can turn serious and even deadly, especially for those who are older or have underlying health conditions.
In these cases, patients develop pneumonia, which can cause.
Avoid people with these symptoms. If you develop them, call your healthcare provider before going to the hospital or doctor, so they and you can prepare to minimize possible exposure if they suspect you have coronavirus. It doesn't matter if you're in a state that has no cases or one case, Fauci said. You have to start taking seriously what you can do now, that if and when the infections will come, and they will come, sorry to say, sad to say, they will, he told reporters.
Fauci, a top expert on infectious diseases who has served in the government for decades, said coronavirus cases continue to add up globally.
He said the administration was paying particular attention to the cases in Europe, Italy and France. Italy is currently in a nationwide lockdown for the disease, which first emerged in China.
But he said it's not necessary to immediately close U.S. schools as a way to try to contain the outbreak, even as individual schools in areas with outbreaks were closed for deep cleaning.
Everything is on the table for consideration, he warned. What we need to do is have less people infected and ultimately have less deaths. You do that by trying to interfere with the natural flow of the outbreak.
Pence added that all advice they had given was to be applied nationwide. But he noted they were working with local governments, such as in Florida, New York, Washington and California, where there has been community spread of the virus.
The VP insisted that the risk to the average American of contracting the coronavirus remains low.
But they questioned why travel bans had been implemented for the likes of China and Iran amid the outbreak but not yet Italy or Japan.
Tuesday there were 59 new confirmed cases in Japan, the highest single-day increase globally since the start of the outbreak.
Total infections had risen to 1,278 cases, including 696 from the Diamond Princess cruise ship and 14 returnees on charter flights from China, according to NHK data. One new infection was reported early on Wednesday, in the western prefecture of Hyogo. Japan has now seen 19 deaths from the virus, including 7 from the cruise ship, the public broadcaster said.
Italy is the second worst affected country after China and went on lockdown Monday night.
Pence simply replied that the U.S. would be in different place if Trump hadn't suspended travel from China and issued advisories for South Korea.
We had very thorough discussion about travel advisories, Pence insisted, added they are following facts, and will bring forward recommendations in a time and manner that's appropriate.
Pence said it's a day-to-day consideration, but reinforced they're putting the health and safety of America first.
As of Tuesday night, there were 959 confirmed cases of coronavirus in the U.S., and 29 deaths.
As the novel coronavirus spreads across the globe, health experts advise plane travelers to sit in a window seat, disinfect their table trays and window blinds, and warn that wearing a mask won't prevent infection.
Officials say the best way to avoid catching the virus, which is spread through viral particles within mucus or saliva, is to keep your hands clean, disinfect your space, and avoid touching your face.
It is also advised that plane travelers choose a window seat to have less contact with potentially sick people.
Book a window seat, try not to move during the flight, stay hydrated and keep your hands away from your face, Vicky Stover-Hertzberg, professor of biostatistics and bioinformatics at the Rollins School of Public Health at Emory University, said.
Hertzberg helped conduct a study that followed passengers and crew members on 10 3- to 5-hour flights during the flu season and found that passengers who sit in the window seats had less contact with ill people.
Wearing a mask on the plane may not prove helpful as the air in the aircraft is considered sterile because there are so few microorganisms at such a high altitude and the plane draws fresh air from the outside.
About 50% of the air in cabins is recirculated, but it goes through sophisticated air filters similar to those used in surgical environments, before it's pushed back into the plane.
A problem with paper masks is that they don't have a respirator to filter out infectious air particles.
That means passengers are more likely to catch the virus through direct contact from someone with the virus or surfaces rather than through the air.
But one study found that the other coronaviruses, such as SARS and MERS, remains on metal, glass, and plastic surfaces for up to 9 days.
Top tips include
good hand hygiene, frequently wash hands for at least 20 seconds or using hand sanitizer.
Disinfect your space, bring your own wipes and wipe down window blinds, seat belts, arm rests, touch screens and tray tables.
Choose a window seat, sit near the window and avoid moving around the cabin to limit exposure to potentially sick people.
Use touch screen with a tissue. Avoid contact with surfaces that may hold the virus.
Avoid touching your face. 2019 nCoV is spread through viral particles in mucus or saliva. Avoid touching your face and transferring germs picked up from surfaces.